Well, if you have some severe pain or severe trauma in one of your ankles, that makes it a little tough to get around. You might be in need of a total ankle replacement. And Dr. John Kirchner with Southlake Ortho is here in studio to tell us all about it. How are you doing?
I'm doing good. How about yourself, Sean?
Well, tell us, what is a total ankle replacement? What basically does that mean?
For the longest time, orthopedic surgeons have been replacing joints, shoulders, knees, hips. Ankles came onto the market in the 80s, but didn't do so well till more recent sort of design changes have occurred. And since that time, we've been having a lot better success, rivaling that of total knees, which you hear can last people a lifetime. Similar to the knee replacement, you're talking two pieces of metal covering the two ends of the joint, and then in between you're going to have a polyethylene, which is a low friction bearing to allow the motion to be smooth.
Yeah, I think we've got an image of something. You can kind of tell us what that is, that silver piece. What is that? And that's in the ankle that you'll put in, right?
Correct. That's going to be the bottom half of the ankle. That's the talar replacement. The talus is the bone that rolls inside the ankle, and the tibia is sort of the flat surface on the top. You'll resurface that on the top with this metal plate, and then it's got the polyethylene in between, and then this other is going to be your talar component of it.
Yeah. And you were showing, you got a little prop right here, John, if you want to take that and I'll show it. Yeah. Show us again where you're talking about right there.
So the talar component is right here,
and
that's the part that you saw the picture of. And then the white is your polyethylene, the bearing.
What type of condition would you have for needing this type of ankle replacement?
The one where you get the larger piece is if you have a significant trauma where you've lost the blood supply to the talus. Talar body fractures, or some people who do a lot of steroids or have a lot of steroids for like rheumatoid arthritis or some of the other inflammatory conditions. The steroid can sometimes cause the bone in your ankle to soften, and then it collapses, and that's when you're going to need good, healthy bone to replace that.
Okay, if you go through a total ankle replacement, what's the recovery time for something like that?
It usually is 3 weeks where you're non-weight bearing. That's to let the incision heal. The incision's on the front of the ankle, and if you look down at your ankle, there's not a lot of good skin and soft tissue between the skin and the tendons below it. So you want to let that skin heal. And then about the 3-week mark, you start being able to walk, put weight on it. We usually have people walk for the next 3 weeks, and then we'll start therapy, physical therapy, either at home or sometimes in rehab, for about the next 3 to 4 weeks after that.
But sooner or later, you're going to feel a little bit better and be able to get around.
You'll be amazed that I've had patients who have come in at the 3-week mark and said, I haven't felt this much pain relief in a long time. Even if my ankle's not wiggling much, I don't feel that pain.
There you go. A total ankle replacement may be in your future if you have that type of symptoms that are happening there. Dr. John Kirchner, thank you so much from Southlake Ortho. We appreciate it. We've got more coming your way. Stay with us.